Hey guys, what's going on? Sherman here. I was taking some time today to clean out some of my first aid kits that I had because I have multiple ones. I don't know if that's common. I don't know if you guys have a lot of multiple kits, or maybe I'm just weird. But you do have to go through them every now and then if you have things like medication in them, like your personal medication, or things just simple as aspirin, different types of pain relief, because they do expire. You do have to go through them and take inventory basically. So that's what I was doing. And I had it all out here on my bed, and I thought I would just make a video talking about my first aid, IFAK, whatnot, setups, and just kind of talk about first aid gear for a little bit. But this is literally all of my first aid related supplies, with the exception of one ace bandage and one rolled gauze that is in my ITS Tactical Fat Boy. But I didn't want to just take them out, but they're there. So this is pretty much all of my medical supplies. I have them kind of separated in categories. And what I really want to do is take some and just put them in my everyday carry setup, which I do. That's over there, right there on the left. That's my everyday carry first aid kit. And then I want to set one aside to just have a dedicated, not really bug out, but just a dedicated blowout kit, which is that stuff over there on the right, which I'll show you here in just a minute. But other than that, I want to get all of these supplies in just one big bag. Because, like I said, some of these were separated. They were really separated between 3 different kits. I had my at-home, just plain first aid kit, just had BandAids, antiseptic wipes, and that was it. And then I had my Maxpedition FR1, which had basically like my camp out setup. It had more things like bug bite ointment, burn creams, and it had gauze pads, and it had BandAids and different stuff like that. It was kind of like, I guess, like if my at-home just BandAid and antiseptic wipes kit was like a stage 1 kit, I guess that'd be like a stage 2 or like a level 2 kit. And then I had like a level 3 kit, which was my bug out setup, which had syringes, it had suture kits, artificial airway, different stuff like that. Scalpel blades, Sealox, which is a wound sealer, kind of like Quick Clot, blood coagulant, different stuff like that. Heavy duty trauma related items. And then I had my everyday carry setup, which was basically a combination of the two. Like I said, I will get to that in a minute. But yeah, I just wanted to just make this video and show you guys what I have. Maybe give you guys an idea for your kits, because I love watching first aid videos. I love getting an idea, see something here and there and be like, oh yeah, I think I should get one of those for my kit. Like I said, hopefully you guys can get some ideas for your kits. But it's really important to ask yourself first, what kind of kit do you want? And, I wanted something that covered all the bases. I wanted something that in a bug out situation, I could deal with heavy trauma. So I have that kind of stuff, and just want to show you my stockpile. Let's start over here. This is basically all of my wound dressings. These are a bunch of different size gauze pads. And let me tell you guys something. It really doesn't matter what brand you get. All brands do the same thing. It's all the same gauze. So it really doesn't matter if it's an off brand. It is going to work no matter what. So these are all just different gauze pads. You can see they're pretty stacked up here. These are all different sizes. Some of them have different purposes. Some are non-stick. They have like a Telfa surface on them, which means it's basically like the surface of a Band-Aid. If they're non-stick, then they have Telfa on them, or some kind of non-stick surface. What it does is that it kind of, like I said, it feels like the bottom of a Band-Aid. You can take a Band-Aid off and it doesn't stick to your wound. This will do the same thing, but most gauze pads will stick to a wound, and when you take time to change your dressing, sometimes they can take the coagulant out of the wound and make it bleed again. So it is important, I think, to have non-stick ones. This is a non-stick gauze pad. I have a bunch of different sizes, like I said. This one was in my bug out kit, that's why it's in a little bag, separated. ABD pad. It is extra absorbent. It's basically a trauma dressing. You'll hear them called surgical pads sometimes. This came with a kit that I got on Amazon. Here again, it's a surgical pad. It's extra thick. You can find these anywhere too. I know that the CVS drugstore that I go to sometimes, they sell these individually. You can get them. They're like 99 cents a piece. You can get them in different sizes. You can get them in non-stick or just regular. This is some of my rolled gauze, 2 different sizes. This is basically a glorified Israeli bandage. It is a pressure dressing. If you don't know what that is, Google it. Basically, just in a nutshell, it is a wrap, like a gauze wrap, and it has a plastic, basically it's like a plastic stick you put on the wound, then wrap it, and it applies pressure, because pressure is necessary in, you know, sealing those wounds. But that is a trauma dressing. It's made by, what is this made by? North American Rescue, something like that. Yeah, North American Rescue. Look them up online. These are great products. Then I have this. It is Z-fold. I think it's S-rolled gauze. See, it's in a little square block. It is vacuum sealed, so it makes it extra compact. These are good to have. That is a lot of gauze. How many yards is this? It is 4.1 yards stretched, which is a lot of gauze. I have an eye cover. You know, that's, in my opinion, kind of one of those things that you don't know you need until you need it. Ace bandage comes in handy. So like I said, that's all the gauze, gauze pads and wound dressings that I have. You can also, of course, use those to clean wounds. What you would normally do, your step 1, clean the wound. Step 2, dress the wound. Step 3, seal the wound. So that's like kind of like step 2. Step 1, you'd want to clean it. That's when we come over here. You have all my antiseptic wipes. You can never really have too many because you can go through several with just one wound. So I have a bunch of different types, different brands. Quick Clean, you can see there. It's just alcohol prep pad. Mostly they're called like prep pads or like antiseptic pads, but they all do the same thing. They all clean wounds. They all have alcohol in them. Like I said, they all do the same thing. So I got a ton of those. So like I said, you can never really have too many of them. And after you treat somebody's wounds, obviously you can use them to clean off your hands, which is important. If you're not wearing gloves, which really you always want to wear gloves. So over here is my pathogen protection, basically. I have a couple of masks you could use in case somebody's, you know, coughing and whatnot. You can get close to them. You don't have to worry about them like coughing blood or, you know, just spit even. You just don't want people coughing on you or getting like arterial spray in your face. Like I'm talking about absolute worst case scenario when I say that. But I got that. Gloves. Here again, something you really can't have too many of. I have a ton of gloves. This came in one of the kits I had. It's actually a little baggie with gloves with a biohazard sticker. So when you're done cleaning the wounds, you can put them in there with the biohazard label on there. Ointments and everything will be here. You know, you have your triple antibiotic ointment. Lip balm. This was in my camp kit. It has things like bug repellent in it, bite cream, burn gel. This stuff is great. That is something that I see a lot of people don't really account for in their first aid kits, and that is burn treatments. So it's really important to get those non-stick pads, the non-stick gauze, burn cream. They make dressings especially for burns. That's kind of important to have. Histoprin, it's an antihistamine cream. Just different random stuff here and there. That was in my camp kit, poison ivy cleanser. There's also Neosporin. It's a spray. So I have Neosporin spray and Neosporin in the tube. Like I said, it's just different antibiotic antibiotic ointment you put on a wound and cover it up. Just keeps it from getting an infection. Keeps it from getting infected. And like I said, burn gels. Those are all my creams. In terms of medication, which was what I was really getting into and trying to clean out, because like I said, these do expire, so you do have to go through and take inventory, because the only problem with having things like bug-out kits and big IFAKs, individual first aid kits, is that you stock up on these items that some of them can expire, with the intentions of maybe having to use them someday, but then you don't end up having to use them, which is a blessing. You don't want to have to use your IFAK or trauma kit or whatever you have. You don't want to have to use it. So, like I said, sometimes you do have to go through and do inventory to make sure that your kit is fresh and ready, basically. So I have a bunch of different types of bottles. Now, I don't normally store the bottles in there. I usually get those individual pill bags, and I write down the dosage. I write down what type it is, when it expires, and that makes it a lot easier to carry, so not having to carry around these big bottles. But I haven't gotten the pill bags yet. But I have extra strength pain reliever. This one is acetaminophen, 500 milligrams. It's important to have different types because some people are allergic to different kinds. Some medication does different things. Like I think acetaminophen, it's a pain reliever and fever reducer. Not aspirin. Whereas as an allergy reliever, this is ibuprofen. And it's also a fever reducer, but I think ibuprofen reduces swelling. I can't remember which one reduces swelling. And then I have Advil, which is also ibuprofen, pain reliever, fever reducer. Bayer aspirin, which is good if somebody feels like they're getting a heart attack. You'd pop one of those in their mouth, make them chew it up. And it has been clinically proven to greatly reduce the chance of having a heart attack if you feel it coming on. So it's important to have on hand. In here is just simple things like Pepto-Bismol, Motrin, different stuff like that. And here again, different pain relievers, antacids, stuff like that. There's some anti-diarrheal in there. Just different things you never know you might need. And then just the simple boo-boo, the boo-boo kits over here. Different small assorted BandAids. You have the butterfly closures, different size BandAids. I actually need to get more. I'm running low on BandAids. Moleskins, you put those on blisters, different stuff like that. Over here, just different assorted items. I have 3 different cold packs. Good if you have swelling, anywhere. Put those cold packs on it to reduce the swelling. If you have achy joints, whatnot, get a bad bump, whatnot. It's just kind of neat to have those on hand. I don't carry those in my everyday system just because I don't think they're that necessary, especially in the winter. Now in the summer, excuse me, in the summertime, I'll sometimes carry one. Somebody gets too overheated, they can try to cool down a little bit. I think some of you might already know what this is, but these can be important too. Put it in a wound, and these will expand, and they're meant for absorbing. So it's nice to have at least one of these on hand. You never know. I've talked to some cop buddies of mine, and they've carried these for emergency gunshot wounds, different stuff like that. So it was one of those things. It was around. Why not throw it in a kit somewhere? So, like I said, its purpose is for absorbing, and you can insert it into deep wounds, whatnot. So, yeah, that's all I'm going to say about that. Celox, it is a blood coagulant. It is, you can see, clots blood fast. It's a hemostatic agent. So, what it is a powder. You would rip the top off, kind of like Kool-Aid, and you'd sprinkle it in a wound, and it will coagulate the blood. So it helps, if you have a deep wound, it is bleeding profusely. What I would recommend something like a quick clotting sponge, but if you don't have that, maybe it's not that bad of a wound, but it is bleeding profusely, maybe it needs stitches. You'd sprinkle that down in the wound first, then you would pack it with something like the gauze pad and then cover it, and then tape it up. So I have that. Thermal blanket, obviously these are great if somebody's going into shock or hypothermia. You'd wrap them up in this, and it will greatly help. You got that. Like I said, down here, this is my everyday carry system. So I kept it together just so I'd remember where everything is. Just simple rolled gauze, some cloth tape, of course, gloves. One of my favorite first aid kit items, Quick Clot Sport. Stops bleeding fast. Now they make a bunch of different types of quick clot. This is the clotting sponge, as they call it. There's Has directions on it. You just put it on a wound, cover it, or pack the wound, and then you cover it up. Great stuff. This is really, it's hospital grade stuff. Really expensive though. These are about $10 a piece. Some of them that are treated with colloidal silver are about $20 a piece, but those will obviously be a little bit better because not only is it going to stop bleeding and pack the wound, it's also going to disinfect because colloidal silver is a great antiseptic. So there's that. I also have some non-stick gauze pads in there also, just you know, be double safe. And then is my little simple first aid kit. It has, I've gone through this before in previous videos. I've made a few alterations here and there, but not much. I have some burn gel. I have the tick tweezers from CountyCom. Those are great splinter removers. Those are the best tweezers that I've ever had. Little pair of scissors, you know, to cut open, or to cut gauze if I had to, or to cut the tape. Another pair of gloves. Redundancy is key. There is a scalpel blade in there. And just a couple different size Band-Aids and some different medication. So that's just my simple little everyday carry first aid kit. Basically like a boo-boo kit. Nothing trauma related except for the quick clot and whatnot. Over here is what I had in my Blowout Kit. Another quick clot sport. This came in a kit that I got off Amazon. It came with this and a bunch of other stuff. It was a trauma kit for 20 bucks. Great kit. But anyway, another quick clot, very important stuff. This is one of the ones I was telling you about. You can get at CVS Pharmacy. Surgical pad, you can get these for 99 cents. Very thick, but it's just good to have. And then some non-stick pads. Oh, and of course, bandage tape. This is 3M. You can see Transport. Apparently, what I've talked to a few subscribers of mine and buddies who are EMTs, and they recommended that tape because it'll apparently stick even to bloody surfaces. So that was important. That's apparently some really good tape. Over here is my miscellaneous items. I have a whistle. Very important, you know, if you're out and you're you have hypothermia, or you have a bad wound and you can't yell and you're trying to get somebody to find you, it's good to have something like that. Different things to make a splint for fingers or toes, small splints. Lip balm, yeah, not necessary, but I just have it in there. We have some clothespins, or safety pins rather, and those are good for holding some dressings together, like your ACE bandage or the trauma dressing. Even though they already have their own self-closure device, these are just still good to have on hand. Also, if you make an improvised sling, you can use these to help keep them in place. Of that, just some tweezers that came with a cheap first aid kit, just plastic little things. One of those things, why not? Button towels, these are good. You add water to them, and they unroll into this big little cloth, cotton cloth. Just one of those things that can be handy, cover wounds, you know, use it to wipe off. Different types of tape, a roll of duct tape that came with that trauma kit that I got off Amazon, some more duct tape that I fashioned on a piece of paracord, and a pin tube so you can attach it to something. I did that a long time ago, just for utility, but I kept it in my first aid kit just because. Different tape, some more of that 3M tape, and then some breathable Johnson & Johnson gauze tape. Glow sticks. I saw these in someone else's kit years ago, and I thought that was a really good idea. They were talking about if you had to treat a child's wounds and you wanted to kind of try to keep them calm and keep their mind off of it, let them play with a glow stick, because kids love glow sticks. I think everybody loves glow sticks, but it's one of those things that's bright, you know, it keeps their mind busy, keeps them occupied while you can treat them, and just it'll help with that. So I thought that was a really good idea. It's one of those simple things you don't really think about, but you know, you think about first aid kits, you're not only using your first aid kit for yourself. I hope if the time comes you'll help somebody else. You know, you have enough medical knowledge and you have enough supplies to be able to help someone else if you have to. So one of those people may be a child, and like I said, this can kind of help. So, like I said, it's one of those very simple things that I didn't think about, and I was like, oh, that's actually a really good idea. So there's that. Another thing, a little finger splint. It was just kind of one of those things laying around, so I threw it in here from a previous injury. Q-tips. You know, use them as swabs. It's one of those things you can take for granted sometimes. I forgot why I put this in here. Just a little pair of pliers. Just maybe you need a tool, whatnot. Somebody sent me this with a trade item, I think. I just kind of threw it in, so I just threw it in one of my kits. Sharpie markers. Use them if you're using a tourniquet. You'd write down the times and whatnot. But obviously you can use these to write on anything. I don't know. One of those things. I just kind of threw in one of my kits, just because you never know if you might need to write something down. Hemostats. Here again, important item. No, these are not sterilely packed, but it's one of those things where this was in my bug out kit, and you know, if you need them, you know, you just got to use them. Like this for bug out. Obviously, if you have to use hemostats, it's probably a serious situation. But what you do is you use those to clamp off arteries and whatnot, so they don't continue to bleed. But you can use them for other things too. All right, now is my different cutting tools. I have a Benchmade rescue hook. I forgot which number this is. They're all numbered. I think this is the Rescue 5. So you see the black coated one. I've already done a review on this. It is great. I just keep it in the sheath. I did keep that on my Blowout Kit, but I replaced it with my trauma shears. These are Meritac brand, stainless steel. Got these off of CountyCom. The shears are great. Obviously, both the rescue cutter and the shears have their own purpose. The rescue cutter is going to be better for cutting seatbelts off of people, different pieces of clothing, and this can help with other pieces of clothing. Obviously, you know, you can cut seatbelts with this too, but it's faster with the hook. So they both have their own role, so I have both. This one is my favorite rescue hook I've tried so far. This is the Leatherman Z-Rex. I don't think I've done a video on this yet, but I did upload a picture on Instagram. I will do a review on this also. Just real quick, aluminum handle, 440C reversible cutting blade with the oxygen wrench. Or is that the oxygen wrench? One of them's a wrench for oxygen tanks. It has a carbide glass breaking tip on the bottom. Kind of a karambit grip on it. Extremely comfortable. Like I said, I love the little hole there, so you can kind of release it, work with different items, and then put it back and get to cutting. But I have tested it out a little bit, but I will do a full review on this. It's a great little item, for about 20 bucks. So I keep that. I keep that on my everyday carry system, just in case, like I said, you have to respond to somebody like a car accident. You can help them get their seatbelt off. And like I said, obviously cut different pieces of clothing off with it. And not just that, you can use it to cut paracord, cut straps, whatnot. But I actually keep that on my Blowout Kit now. I keep the trauma shears in my bag as a part of this system. So I have kind of two different systems that I carry every day. My Blowout Kit, which is trauma related, and then my just average boo-boo kit for just everyday cuts and scrapes. That leads me to the final part, is the major items, as I was talking about earlier. This is like the major bug out type stuff. I have little bottles of super glue. Not Crazy Glue brand, it's Scotch, but super glue with super glue. Just little tubes like that. These are great for sealing wounds if you have kind of like a bad cut. These won't work on like an open wound. These work best on the flapping wounds. They have a little flap. You can put some glue over that, cover it up, and it will seal it. Because super glue started off as skin glue back in Vietnam. Now, I know that they sell skin glue that you can buy that hospitals use, and it's like sterile glue, but I've been using this for years for covering wounds, and I don't think there's anything that bad in it. So, obviously, I know a ton of people who use super glue in their kits. Number 10, scalpel blades. You know, you never know. Here again, this was in my bug out system. This is not something, obviously, I'd recommend carrying in an average first aid kit, but this is an absolute last ditch scenario. Different syringes, here again. You never know. For a bug out scenario, like I said, this is not in my average everyday carry system. Suture kits, needle already threaded. And finally, a nasopharyngeal airway, NPA, artificial airway, whatever you want to call it. So I got that. Here again, not something you'd want to use in an everyday system. You can do that wrong and really mess somebody up. So not recommended. And it comes with some lube, some sterile lube. look up some videos on how to put one of those in. It'll probably gross you out. So anyway, guys, that is my that is all of my first aid items that I have amassed over the years. So let me know what you guys think. Let me know if there's anything you think I need. Obviously, there are some things that I would like to get. I want to get a chest seal for my trauma kit, different things like that. I know there are different things that I would need. I need some. Another things I want to get is iodine, something to irrigate wounds, wound cleaners, different stuff like that. CPR mask, things like that. So, like I said, I know there's some things I could add to this, but I would love to hear your guys' opinions. I'd love to hear your system. I know you can't do video responses anymore, but I would love for you guys to make a video showing your own personal first aid system. All your different first aid items, your different first aid kits that you have, your trauma kits. I would just love to see your guys' kits. So you can make a video and then link it in the description. Send me a link to your video or tell me you made a video and I'll go check it out on your channel. But anyway, guys, like I said, if you have any advice for me or any ideas for different things I can add, please let me know and let me know what you think of the things I already have. All right, guys, have a great rest of your day. Stay safe, stay sharp, and God bless. Sherman614, peace.